If you've chosen to collect samples using the BD Vacutainer push-button blood collection set, select and prepare the site as we've just discussed. Peel back the packaging at the printed arrow to expose the entire wing set, and grasp either side of the rear barrel of the wing set with your thumb and forefinger. Remove the set from the tray, taking care to avoid pressing the activation button, which is clearly marked with an indicator arrow. Perform the venipuncture using your usual winged set technique, either by holding the wings together or by grasping the body of the set. Notice that the indicator arrow on the button shows you exactly where the blood flash appears as the vein is entered. Pay close attention to both personal safety procedures and proper aseptic handling techniques, and remember to fill a discard tube first, following your institution's guidelines. A BD Vacutainer No Additive Plus plastic tube can be used as a discard tube. Using this technique to fill the tubing with blood ensures that the first tube collected will contain the correct amount of blood additives present. The BD Vacutainer push-button blood collection set is designed to be activated while the needle is still in the vein, after the last specimen tube is collected. When you've removed and mixed the final tube, place a gauze pad on the vena that covers the edge of the front barrel. While maintaining contact with the patient and without withdrawing, hold the device by the rear barrel with the thumb and middle finger, and activate the safety feature by depressing the button with the tip of the index finger. The needle will automatically retract from the vein. To ensure the complete and immediate retraction of the device, hands away from the end of the blood collection set during retraction. Apply pressure to the site according to your facility's protocol. Visually confirm that the needle is in the shielded position, and immediately dispose of the entire BD Vacutainer push-button blood collection set and holder in the nearest container, following your facility's policies and procedures. To help you sharpen your phlebotomy skills, here's a collection of key points to remember during venipuncture as recommended by BD's ASCP certified medical technologists, part of the BD Vacutainer Technical Services team. Always wear gloves when working with blood or body fluids. Allow the alcohol to air dry after cleansing the venipuncture site. The tourniquet should remain on the patient's arm no longer than 1 minute. Remove the tourniquet as soon as possible. Be sure to check the expiration dates on Vacutainer blood collection tubes. Never use expired tubes. Always follow the correct order of draw. Mix all tubes, including plus plastic serum and SST, with the proper number of inversions. Immediately activate the needle's safety mechanism and dispose of the needle or blood collection set, along with the holder, into the nearest appropriate sharps container. Always be sure that all bleeding has stopped before leaving the drawing area, and label all specimens according to your facility's guidelines.